A lot of people don't realize this, but it was one medical formula that might have delayed kidney transplants for thousands of black patients in America. So let me break down to you what happened. Doctors use a number called eGFR. And basically what eGFR is, it's a lab calculation that they use, and it estimates how well your kidneys are working and how well your kidneys are not working. And the problem with the older version of this calculation is that it had a race adjustment for black patients. And so that race adjustment that they have for black patients, it can make their kidneys look healthier than they really were. And it became an issue because if your kidneys appear healthy on paper, then that could delay when you're recognized as sick enough to even be referred for transplant evaluation or placed on the kidney transplant waiting list. So it wasn't just the math itself that was an issue. It was controlling when these patients actually got access. And so a few years ago, they had a policy change, and it required all the transplant programs to review their waiting list and give eligible black patients credit for the time they might have lost because of these old race-based calculations. And in 2026, we're starting to see the impact of, the change in those. And so this week, new reporting said about 21,000 black kidney transplant candidates got waiting time modifications, and they gained about 1.7 years on the waiting list. And so they also found more transplants for black candidates after this change, and it didn't change any non-black patients' access at all. So it didn't hurt anybody else at all. And so this is a real example of how a medical formula can shape who even gets this timely access to care. And it's also a reminder that equity in healthcare is not just about what people think of their attitudes. It's built into the systems, the equations, and all the rules. And so when the rules are wrong, a lot of these patients who are sick, they can lose time. And we all know in medicine, time matters. So I'm so glad that as we learn more, we do more, and we do more for patients. And hopefully this helps somebody. If you know anybody worried about kidney transplants and want to learn about them, share this video. And I appreciate y'all for watching. Peace.